First of all is the reach that and M-Health, which is the latest upcoming concept, that you can get through a doctor living in a first-tier city just through a mobile app and get the right kind of guidance as far as health issues goes. So I believe in health equity, I think everyone does. So I wanted to be available for the people who are there in the far-flung places, do not have access to very, very basic healthcare. So MediBuddy is the tool which I think I used to bridge that gap. Hi, my name is Dr. Ashwini Singh, and I've given out consultations through the MediBuddy platform. I was initially giving out consultations particularly to COVID patients, and now I'm taking general consultations as well. I remember there used to be like 100 of notifications on my phone during both the waves, even when I was not with MediBuddy. But the advantage of being associated with this app or with this tool per se is that I could follow up on my patients and see how they are doing further. So I remember this one case particularly. There was a couple and they had a 7-year-old child, and the child had spiked fever and the child was feeling a little breathless. So it was thankfully a video consult, and when I was speaking with the child, I could hear some wheeze because it was a very loud wheeze that I could hear. Since all the clinics were shut at that time and they did not really have any healthcare facility accessible in that area at that point of time, I told them, if you apparently have to have a nebulizer or a steam machine available at your place. So they had a geriatric couple obviously living in their same household, so they happened to have a nebulizer, thankfully. But those people were not there at home, so they could not have really, helped them through it. So I told them that they could nebulize their child, and that will relieve the symptom that the child is having right now, the respiratory problem the child is facing. So they had zero clue, and obviously they were very petrified to just open YouTube and understand how to go about loading a resfuel and nebulizing their child. So I walked them through the entire process. I told them this is how you go about doing it, and I stayed on the call till the entire resfuel was over, until the child had stabilized. And the moment that child caught a breath, it was just so gratifying as a doctor for me, and even for the parents. It was very relieving for them that they could get that magnitude of help just using a phone, or so easily getting through a doctor. Digital healthcare is going to be the future of rural healthcare in India. So I think platforms like MediBuddy are a starting point towards that. Being a healthcare professional, I want to be seen as a useful member of the society. I want to be as useful as a doctor to be possible. So this platform is something which helped me reach out to as many people as I could just through an app, just through a phone. So this helps me do my community service to a really large extent. Otherwise, reaching so many people through physical ways, it's not as possible. But I think AI is something which is coming in a really big way to bridge that gap.